Hi there. Welcome to your Module 11. This week, we're going to talk about the impact of poverty on nutritional status. I'm Maya Nellie Brown. I am currently a dietetic intern. Got my bachelor's in nutrition and dietetics, and I'm soon going to get my master's in nutrition here at UNM. So I'm almost there. But I'm excited to talk about this topic because this is a topic that first got me interested in pursuing this pathway for my career. And it's something that if you continue to stay in this field, are inevitably going to encounter. So the more you know about this, the more you'll be able to empower the folks that you plan to work with in whatever capacity you plan to work in. Okay, so, some of the learning objectives we will be talking about, we want to increase our understanding of how poverty can impact nutrition and health. We're also going to discuss the broader impacts of poverty on an individual and as a family. And then we'll also identify barriers for individuals in poverty to access resources. So here's some food for thought. You've already developed, what food access can look like, food availability. But what does that have to do with poverty? There's going to be a huge connection with nutrition and economic status. So I want to ask you all a question. In what ways might chronic malnutrition serve as both a cause and a consequence of poverty within a population? And how would this cyclical relationship impact long-term economic development? I know this is a big question, but we will discuss a little bit more the definition of malnutrition if you're not quite sure what that technically means here in a little bit. But at the end of this presentation, you'll probably have an idea about how to address this question, because there's this term here, cyclical, and you might hear this a lot, specifically with poverty. Is typically a cycle, and it's hard to break out of that cycle. There's a lot of barriers that folks endure. So, some of the things I want you to take note of are, what are these barriers? How might these people be impacted? And how might that affect malnutrition as well as long-term economic development? And this is kind of a vague question, and I think it's meant to be that way because this can, affect the individual, their family, but even society as a whole. We'll talk about some things that can occur there. So, malnutrition can also affect physical and mental abilities. We'll dive into that, reducing productivity. It could also increase vulnerability to poverty by limiting economic potential. So, it's kind of like the seesaw effect. It goes back and forth, reducing productivity, increasing vulnerability to poverty. Okay. So, diving into food security, this was discussed with Patricia's presentation in your previous week. But as a reminder, this is defined as when people constantly have physical and economic access to sufficient, safe, and nutritious food that meets their nutritional needs and preferences for an active and healthy life. So, a lot of flexibility there. There is choice and access. Access is a huge part of this, and we'll talk about how physical is related to this as well. And there's a resource here, and you can find at the end of the presentation that describes food security as having 4 dimensions. First, having the physical availability of food. Is food around? Is it accessible? Is it easy to grab? Economic and physical access to food. Even if that food is easy to access, can people afford it? Can you actually go get it, right? Food utilization. Great. Now we have all of this food. So what do we do with it? Do we have a place to store it? Is there a way to cook it, to eat it properly and safely? And also, the final dimension is going to be the stability of the above 3 dimensions. All of the 3 dimensions listed above need to be stable in order for one to work over the other. They all are required to define this food security. So I want to ask you all and take a moment to pause and think about this, but what are some populations that are going to be more prone to food insecurity, right? It's the opposite of that security. Those who will not have the stability of the above stated dimensions. Who are some populations you think might be affected by this? I want to share this poverty cycle with you all. And with this PDF, I believe it should be an interactive link. If you have hit the direct link, you can click this to find the website it is from. But you can see this is a cycle, and I referenced this before, in which poverty is a cycle that is really, really tough to get out of. It's a lot of places to meet there, and this might be similar to the Maslow's hierarchy of needs. And it could potentially stem from a couple of those things, but there's a ton of things that go into poverty, right? And it can be tough to get out of the cycle, but they're all sort of interconnected with one another. You can see how the arrows are sort of moving around here. And for us, of course, we care about nutrition, but it also is important to see how this cycle functions because, as much as we know nutrition comes from food, health is coming from a lot of different places. And you can see here it comes from mental health, physical health, finances. Is there access to health? Are people educated? Substance abuse can be related to mental health as well, or chronic illness, disability, social barriers. A lot of things going on there, and folks who are typically in this cycle experience a lot of challenges within these groups. So a lot of things and a lot of facets and a very complicated thing to discuss and something to think about as we proceed with this module. So what are some other factors? I know we've talked about economics, poverty means low income, right? But there are other factors that are going to affect nutrition, right? And we even saw that in that cycle. It's a very complex process. We have this term poverty, right? We know that people who experience poverty are likely going to be more at risk for various things. So what are some other factors we can also put into here? Age. Age can be a factor. Our, as we grow older, there may be different resources that could lead to things like disability, chronic illness, education level, which could also be tied with economics as well, but also, where to find these resources. Is there knowledge of how to utilize like the food utilization, right? Disability was referenced in our previous slide, but disability could pose a barrier to access food, to consume food. Even thinking about something like oral health, not having teeth, the inability to chew food, right? That could be, not necessarily a disability, but a barrier for food consumption, right? Safety, something that, we could take for granted, but a lot of people who live in poverty may not experience this. And here specifically in Albuquerque, there's an area of town, you know it as the International District. Oftentimes there's not a lot of street lighting there. It may not even be safe to go walking or to go to the grocery store, right? So safety can be a factor in overall health status. Housing, do you have access to housing? I think when this clicked for me is when I worked at a mobile growers market where we provided fresh local food to anyone who came up. And I remember giving some vegetables to someone and I asked, hey, what are you going to do with this later? How are you going to cook it? And they said, oh, I actually don't have an oven or a stove, so I'm just going to eat it fresh. And I think to me, because I'm so used to having that and have that privilege in my life, it's not something I really considered. So it really changed my perspective on access, right? And these assumptions that we might make as healthcare providers, right? Employment. Do we have a job, first of all, which can contribute to the housing? And again, those arrows going back and forth. Even if we are employed, how often are we working? Are we working overtime? Do we have time for ourselves to do all of the things, right? Race and ethnicity could also be a factor. There are some folks who experience more risk factors than others, and there's a lot of, underlying reasons for that. We can dive into, you probably have a better understanding with this class, and we'll continue to learn. I hope you continue to think about these things, but that can also factor into that. And access to food, of course, which again, thinking about that poverty cycle, which can mean so many of these things. You may have heard the term food desert, and I want to introduce you to a term, if you haven't heard of it before, is a food apartheid. This is a new-ish term that a lot of food justice folks are bringing into the conversation. There is a slight difference here. Food desert, as you may know, has a certain distance from an individual's point of living and a certain mileage to a source that has fresh, healthy food, right? Oftentimes here in Albuquerque, the South Valley is often used as an example of a food desert because of that mileage. And really, in a lot of New Mexico, there's a lot of rural places that have to drive or transport themselves to find access to healthy food and affordable, fresh, healthy food. I have a friend who lives in Zuni, and it's by Gallup, but I mean, even the food out there can be pretty expensive, right? Food apartheid is slightly different, and I have this linked here. If you have the underlined portion, if you are accessing the presentation via that sort of live link, you can access that or look at the resource at the last page. But you can see where food apartheid is slightly different from food desert, because food desert can be misinterpreted as only being in the desert, whereas a food desert can be in a place that has an abundance of food grown around them, but it can have a lot of other factors. And a food apartheid, food justice leaders believe is a better encompassing word in that it really dives into the higher capacity of what food access really means, which is not necessarily just the mileage point from point A to B, but other things like environment, social justice, food access, tons of things. So that's a really interesting article if you're interested in diving into that. And as I alluded to earlier, access to food storage, right? Do they have access to a freezer, a fridge, right? Part of my experience right now in my clinical rotation is, if you get the sense that someone is malnourished, you may ask, hey, what does your typical intake look like at home? And they might tell you, and you might say, oh, okay. Well, do you have access to a fridge or freezer that if I were to provide you this supplement, if you don't decide not to eat it on your tray, could you take that home? Right? And this is important information to have, not only in a clinical setting, but with anyone you help support with, right? It's just to get an idea of what their baseline is to be better of support. Transportation, can they get to point A to point B? And one thing that stood out to me, especially when in this discussion of food desert and food apartheid, right? Having a car is going to be different from having a bike, from having no transportation at all, utilizing the bus, for example, carrying groceries from point A to point B. How many more groceries can you hold in a car versus on a bike versus taking the bus? Very different, right? And I know this is kind of a long list of factors, but there's a lot more factors other than economic factors that can factor into malnutrition. So I want you to take some time and think about what those could potentially be. We'll dive into the barriers of poverty that poverty can bring for folks. There's a lot of statistics that show healthcare costs increase for those who experience poverty. And a lot of times it's maybe from a lack of having health insurance, where they kind of wait until the last minute and then they inevitably have to go to the ER, which is inevitably higher costs, instead of engaging in that preventative care, right? That folks who do have health insurance might use. And even those who have health insurance may not even be utilizing it because of working so much, not having the capacity, mental health issues, right? Access to care is this huge sort of bubble to start thinking about too. And there's also something called, the white coat syndrome, right? Maybe being traumatized at one point from a healthcare provider and not wanting to go back and experience that again. Transportation again. A lot of the factors here and barriers we already alluded to in the previous slide. Time. a lot of people who experience poverty are wanting to get out, right? They are working overtime. They are not having days off. Their stressors are a lot higher, right? And I know that, with nutrition, we talk about diabetes a lot, and a big factor in getting diabetes is, actually stress, experiencing stress and releasing those cortisol hormones, right? Housing again, how are finances, debt, mental health? Are there language barriers? What about education barriers or access to education? Tons of things to be thinking about for barriers. And again, here, are there other barriers that I haven't mentioned that you can think of? There's a ton of different barriers that people might experience. And this is why it's important to build rapport and understand the folks that we are helping. And that leads to, why is this important? It increases our understanding to allow us to build empathy. Because just like my example I mentioned earlier, even though I was excited about someone being excited about vegetables, I remember they were so excited. I wanted to be excited and share my love for cooking. And, it hit me hard understanding, like, wow, I made this assumption about this person having access to a kitchen when in fact they do not, right? It helped build sort of my perspective on what to expect with people and not to make these assumptions. Instead, be curious and ask questions. It will help us inspire change. We talk about healthcare costs a lot, and there's tons of barriers, even as providers. So how can we help cut through those barriers for folks and provide more access? That's a big part of why I wanted to become a dietitian. Why I'm in the works of doing that is to be able to provide that care, that access for a lot of people who may not have that. Which means a lot of our role is to advocate. That's something I didn't realize when I first started pursuing nutrition, is to advocate for our patients or our clients or the people that we care about. And we can help transform perspective and create awareness, not only with the folks we're helping, but in general as a whole, with politicians, with laws, with people who are around us. It's creating awareness and more understanding and empathy. And hopefully you experienced that with your activity this week. So now we're going to dive into the malnutrition impact on physiological and mental capacity. And I'm curious if anyone knows what this person is doing here with this little baby's arm. They are measuring for growth and development. So defining malnutrition, we've got over and under in micronutrients and over and under in macronutrients. So malnutrition, a lot of times we might think this is, for, underfeeding, right? But sometimes it can also be considered overfeeding as well. And this may be referred to as over and under nutrition. So just a quick sort of definition of that. We understand what malnutrition means, we'll be able to understand its impact on physiological and mental capacity in the context of poverty. I am in my clinical rotation right now, so this is something I see probably 80% of the time with the patients I'm visiting at the hospital, especially for those folks who have underwent, heavy trauma from surgery, from accidents, from length of stay at hospital. So physiologically, I didn't have a ton of room on this slide, but there's tons of things that can be affected. A weakened immune system. Again, I mentioned this happening in the hospital, definitely something that will occur with malnutrition, right? We improve our immune system from the food and the nutrition that we get in our diet, right? And I also have this acronym here, the NFPE, which you may have heard about or will be learning about later. This stands for the nutrition-focused physical exam. It's something that dietitians or dietetic interns can, and even nurses and practitioners can do. It's an exam to assess muscle and fat loss. And what we're looking for is whether there is fat or muscle that has been depleted, right? And this happens from malnutrition, especially in thinking about this context. Again, I'm just thinking of my clinical rotation that folks who are not able to eat their NPO, right? They're going to be at risk for malnutrition. A lot of times people go NPO for, procedures, surgeries, those sorts of things. But if they are experiencing that for a long period of time, are more likely to experience that depleted fat and muscle. This is why we look at weight loss over a period of time as well to contribute to that diagnosis of malnutrition. Impaired wound healing, impaired growth and development, especially for those kiddos. We'll talk about certain populations that are affected more by this. Skin can be affected. A lot more physiological things can occur there, but growth and development or even maintenance is really important. Mental capacity is going to be affected because of that cognitive development as well as maintenance and mental health. We saw mental health in that poverty cycle, right? So if we are worsening that or engaging in that more, right, we're going to be stuck in the cycle. So again, not an exhaustive list of physiological and mental capacity, but hopefully gives you a sense of what that can be impacted by, how it can be impacted, and what are the potential consequences of that. So who is at risk of malnutrition? Essentially, this is something we are dealing with all over the world and all of the time. It is a huge global challenge, especially now with higher population. Things like war and famine can contribute to this as well. Some populations who are at risk are going to be the elderly, women, infants, children, and adolescents, more particularly at risk for malnutrition. Really, everyone is, but a lot of our immunocompromised folks that are mentioned here are definitely going to be at risk. So definitely want to optimize nutrition early in life, right? And if that doesn't happen, it can have long-term consequences as well if we don't do that. Poverty can amplify this risk of malnutrition. Again, think about those barriers, those risk factors. How do they tie into that poverty cycle that we looked at the beginning of this presentation? Malnutrition can increase healthcare costs, right? Reduces productivity and slows economic growth, which can perpetrate a cycle of poverty and ill health. So again, going back to that cycle, right? Reducing productivity. If we're increasing those healthcare costs, they'll just continue to increase for everyone, right? Healthcare and access is expensive. It's stressful. At least here in the United States, it's different all over. But it's something that could reduce productivity. And, if this cycle of poverty continues to go on, same will this cycle of increasing costs overall. So who else do you think is at risk for malnutrition? In this next slide, I've pulled the report from the International, the United Nations. The most recent report from 2024, it is linked in this photo and also linked at the end of this presentation. But this is the sort of increasing prevalence of undernourishment all over the world. The statistics, I think, if we were to add it all together as a whole for a certain percentage, over 50% of that is going to be in Africa, right? And there's a lot of things going on there, reasonings for why potentially that is. There's tons of stuff that we could dive into. Wouldn't have time for that. But something to get you thinking about, where in the world are people experiencing this malnutrition? So make sure to check out that report. It's something interesting to keep in mind. And I pulled a quote from that particular report. They mention, going beyond hunger, the prevalence of moderate or severe food insecurity remains above pre-pandemic levels with little change in 4 years. In 2023, an estimated 28.9% of the global population, this is about 2.3 billion people, were moderately or severely food insecure, meaning they did not have regular access to adequate food. These estimates include 10.7% of the population, 864 million people who were food insecure at severe levels, posing grave risks to their health and well-being. And this is interesting because it does talk about pre-pandemic levels. Think about that. The COVID-19 pandemic is probably going to severely affect statistics and studies and how we view malnutrition, right? Things like that are going to be affected and always going to be changing for as long as we are, alive, right? So I hope that this week's presentation was interesting to you. Here are all those references. Again, if you click the interactive link on the lesson, that's going to be the live link. where you can access those links within the slides. Otherwise, you can access that here. But thank you so much for your time and your concern. I hope that you learned a couple things that are new that make you more interested in wanting to become a dietitian if that tends to be your path.